You know, the WHO puts it on their website, so does the CDC. It says one of the biggest threats to public health is vaccine hesitancy. There's over 20 scientific instruments or ways to measure vaccine hesitancy, which in itself is its own disease. It is a mental psychological disease as proposed by public health officials.
They have an ICD-10 code for it, by the way.
Yeah, so when you think about this, everything the CDC does, it justifies if it's combating vaccine hesitancy. So let me give you an example. It's called the National Immunization Survey, NIS, and there's a fall respiratory virus module, okay? The CDC does not report to us the true numbers of who takes flu shots or COVID shots. They don't. They actually do a phone survey, a random digit dial phone survey. A robocall comes into households, and they keep calling and calling and calling until somebody picks up the phone and is willing to undergo an interview over immunization practices. And then they have a statistical modeling that does not allow the number they get, and they do it each week, the number they get each week of the percent takers, they don't let that number go down. It can only go up. So it is this accumulation. And so you can imagine a phone call comes in after calling 100 people, nobody picks up. Finally, somebody picks up and said, this is the CDC. Do you want to talk to me about vaccines? So someone who's far more likely to have accepted a vaccine is going to present themselves to the CDC and then engage. Well, the number that's coming up that the CDC says of overall population who took a COVID shot this last year, a booster, is 17%. That's based on this phone survey. I want to tell you, I'm an epidemiologist, I study this. That is far from reality. It is a contrived number. It's never been validated by going to some vaccine administration records. Listen, the government buys all the vaccines. They then ship them to the pharmacies. The pharmacies are administering the vaccines. Our government can tell us who took COVID vaccines and who didn't. They won't, because they don't want to injure or they don't want to promote vaccine hesitancy.